Here we go. So, and Vanessa, you're going to talk about designing for resilience, navigating changes in service systems. And I guess you're going to walk us through your PhD studies step by step in a while. It's going to be super interesting, and it's been huge interest as well. A lot of people signed up for this seminar, which is great fun. And I'm just going to say, since it's a seminar setting, we don't have open mic. So if you have any questions, please just write them in the Q&A. And then I'm going to moderate some questions at the end of the seminar. So I'm going to read out a few questions to you, Vanessa, so that you can elaborate on that. And a little bit about this seminar. We started actually last spring with the Corona to vamp up our seminar series. But before that, it was the autumn of 2019. We invited Tim Overkamp, who also did his PhD in Linköping University, like you, Vanessa. And the thing is that there are so many great so much great research being done in Linköping. And since I'm working full time and also I have a hard time reading, I think I'm partly dyslexic, I decided to invite Tim to kind of present his findings and his PhD work. And that was a great success. This was pre-COVID, as you can see. So we actually met physically in Svid's location at Skeppsholmen here in Stockholm. And then COVID happened, so this was put on ice, but now I'm super happy, Vanessa, that you will take up the relay stick and continue this tradition. And then hopefully we'll have more PhDs from Linköping and other universities talking throughout the coming months. A little bit about Expedition Mondial. I founded it together with Fredrik, and we're a service design company based in Stockholm, and we're focusing on creating social change or social benefits and sustainable change. So we use service design to develop, of course, services, but also as an approach to design strategies and visions, new business ideas, and more we're also working with building our clients' own capacity to work closer to the customers or to work with a service design or a design thinking approach. Here's a sample of our clients, everything from big multinational companies to startups. We've worked quite a lot within the public sector, which is great fun. They have their own challenges, of course, and quite a lot with digitalization and challenges like that, where we try to add the customer value into these changes. And Vanessa, now I'm going to hand it over to you to share your findings and your thoughts and your results from your PhD studies. So I'll just stop sharing there.
Thanks, Erik. Before I start off, I would like to pose a question to the audience, and that's to understand, what does resilience mean to you? So I would like you to go into menti.com, and I'm just putting down the code here. So if you could all just head over and take a minute to write down, what does resilience actually mean to you? I'm also going to share it here. So
the Menti address and the code is in the chat.
In the chat, yes. Yeah, but I see some familiar ones. So adaptation, elasticity, strength, sustainability, flexibility, ability to cope. There was also some bouncing back, circular, resistance, and it's really quite the mix. So keep your answers coming in, and I will share the final word cloud when we also share the presentation. But for now, I'm going to. switch over. So resilience then, clearly there's a lot of different meanings to what resilience is, and it's talked about a lot in the systems and individual context. And resilience is a term that has been used for a long time and in several different ways, and it almost always changes depending on the domain where it is used. So resistance would be more in terms of sort of manufacturing, those kinds of things. You have fault tolerance in software development, you have adaptability in terms of ecological systems. So when I started off, there was no one clear way of how this was defined. And people were just arbitrarily using the term as like, oh, you need the system to be resilient. But guess what do you want the system, or what do you want me to do then? And that's why I started off with this, started going into the theory. So in this presentation, I'm going to just share some of the theoretical perspectives that I've used in my thesis to sort of lay the groundwork. And then I'm going to get into making the case for resilience and where I see that service design can sort of help create this resilience. So to start off, service dominant logic, what do I mean with that? Early marketing literature was focused on goods dominant logic, where value was understood as being embedded in goods. So you can think about it as being more connected to economic or monetary value. In the early 2000s, in service marketing management literature saw a shift to what is called service logic or service dominant logic. And here value is understood as being determined by the beneficiaries. So you and I as receivers of the service determine how valuable something is to us. So as an example, the price of a life vest might be 800 Swedish krona, but the value for me is its potential to save me from drowning if I fall off my paddleboard when I go out. So that's one thing to remember. The other is the understanding of service design and how it has evolved in service management literature. So earlier studies focused on new service development, which was basically new product development that they kind of just copy pasted and put into services, in understanding services. And in this new service development literature, service design is limited to being understood as a phase in the process, as opposed to being the whole process as we in service design might understand it. And it's quite focused on planning and control. However, in the last 5 years, we've seen the shift towards the design for a service perspective. And here, design is understood as being co-creative, inclusive, transformative, experimental, experiential, and that it takes the context into consideration as well. The designing for service perspective also acknowledges the potential for creating the right preconditions for service interactions. So we don't go in with the idea thinking that this is going to be perfect, but rather understanding that we can only create the basis for providing a good service, and then we kind of adapt on the way. And this is very well aligned to a resilience approach to management, which also assumes that future events are unexpected, and it only requires you to have a capacity to be able to accommodate such events. Next was systems thinking. So traditionally, service research was very limited to dyadic interactions, so one-on-one, probably between like the frontline employee and me as a customer. But now research on services has evolved to incorporate many-to-many interactions amongst different people within service systems. And service providers are shifting from this dyadic perspective towards defining their role and what is their contribution within the systems. So such service systems can be understood as configurations of people, information, technologies, and other resources that kind of interact with other service systems to create value. And here we have the model that formed the basis for my understanding of services was that it's at the micro, meso, and macro levels, and that it is essential to sort of be able to zoom in and zoom out between these layers to get a better understanding of how the services work in tandem within the system. So, making the case for resilience. The problem that I found, or I started out with problematizing the literature, and often resilience is spoken of as being a very abstract characteristic of the system, like it will somehow automatically be resilient. And what happens is that this view often ignores the human element of systems. It's actually us, we the people, how we determine responses to changes that happen in service systems. And this is an intentional capability. It is, for example, in the healthcare system, it's not some random unseen person, like object that is going on and carrying on, but it's actually the nurses, the doctors, the other handläggare in the commune, and all of these people who are in some way, at some level, making some decisions to provide healthcare to the people who need it. The other thing is that resilience is also often focused on individual efforts, and that kind of doesn't match up with some of the extant research in services, which emphasizes network systems and the importance of collaboration in creating value. And therefore, the onus of the system resilience also needs to shift to multiple actors and their intentions, not only be limited to individual ability. Then we have this assumption of bouncing back or forward, which I also saw on the word cloud that some of you mentioned. And that's absolutely right in some ways. And they emphasize like bouncing back or forward, depending on how it is, to the previous or a new equilibrium state. So this also somehow suggests a return to an earlier normality without really questioning what this normality entails, and that it might not necessarily be desirable nor possible. So much of resilience building literature focuses on responses to crises or large turbulent events while overlooking the impact of small, gradual, and cumulative changes that occur. So while bouncing forward as well suggests movement in new directions, it still is assuming an equilibrium state of stability in the new state. Whereas when you think about it as an ongoing process, then it emphasizes the ability to succeed in varying conditions, or that we create the conditions to succeed. And when we think also of the current pandemic, maybe it might be that we want things to go back to normal, but we don't know if that normal is going to be normal for us anymore. So might be better to think of it as a transition, something that is ongoing. That's the kind of shifts in assumptions that I was looking at. So based on this, what is my view of resilience then? So I define service system resilience as the collective capacity for intentional action in responding to ongoing change, coordinated across scales in order to create value. As an example, we can think about the New York Times, and they kind of shifted from thinking of the newspaper as a product to news as a service, and that kind of saved it from shutting down. And it was Jill Abramson, the editor-in-chief, who wrote in her book, Merchants of Truth, that they realized, the Times editors, that it wasn't because people stopped wanting news. Of course, people wanted to hear what was happening in their communities at the national level and also around the world, but they just wanted a different way to absorb the content. So they came up with a more mobile-friendly digital design. They had daily podcasts, they had weekly television segments and experiments with AR, and that also led to an increase in subscriptions. And this to me is also an example of resilience, because it was not like a one-time sort of break or crisis that they were facing, but in fact, they realized that they needed to transition because of the other changes that were also happening in their environment. And quickly summarize what I kind of then synthesized in the theoretical aspects of my research was using an evolutionary resilience lens. I distinguish between two types of resilience characteristics, which are underpinned by the nature of change. So the first one is adaptation, which is the response to more specific type of variations, disruptions, or shocks, and transformation as an ongoing transition characterized by shifts in meaning, network configurations, relationships, and associated organizational and institutional arrangements. So the resilience characteristic robustness was something that is more associated to the epistemic view of new service development, where design is seen as a phase or a stage. Its emphasis is on planning and control. The response actions are reactive with the focus on recovery. And usually these things are informed by hindsight. When we think about adaptability, it's also under designing for service, but the epistemic view here is design as a process with an emphasis on succeeding in varying conditions. The response actions here are interactive or emergent, and the strategic focus is on coping or improvising, and these are often informed by insight. And then you have transformability. And this is also a little bit of a slower change than adaptability because it's also happening over the long term. And here the epistemic view is design as the capability, and the emphasis is on creating the conditions to succeed. So the response actions are more proactive, and the system is more focused on shaping the futures that they want. And therefore it's informed by foresight. So how can service design help? In my work, I argue that we could harness the potential of service design to enable resilience as well. Service design is quite often positioned as an enabler for innovation, but based on my readings of literature in both resilience, service management, and service design, I argue that I also see it as an enabler of resilience. So to start off with, I think it's important to encourage systems sight. Systems sight here is a specific term which denotes building a sense of the system structure, the patterns, the relationships, experiences, and possibilities. So what you see here is the customer journey map for a private healthcare organization that grew from 1 to nearly 13 polyambulatory clinics, at least at the time that I was there. And before the service designer was hired as part of the team, nobody knew what was really happening in the clinics or what their process looked like. They started off with just being a general GP where you could come in if you have a common cold, and then they added an orthodontist, and they had healthcare courses, and then they had also where you could do your blood tests. So they had a lot of services going on, but then nobody had an overview of what is actually happening or how does the patient experience this service. So the designer kind of did some research and observations and found a lot of inconsistencies in what was happening. So we set to work and started mapping the journeys through these different services and simply putting things into perspective from the broader system of these multiple services made people aware that they were in fact not providing what they thought was good service. So what this essentially did was help make the case for reorganizing and streamlining a lot of the process. And this in turn also lowered the waiting times and total time spent at the clinic for the patient. So it was quite the win. And it was kind of amazing because in the beginning the other team members didn't really know what the job of the designer was, and they still don't really know, but they just always remember that, oh, you're the one that came and sort of cleaned up all of this and made us realize how this process actually works. The next has to do is defining an envelope of variability. And this has to do with attempting to standardize and reduce variation as much as possible when providing a service. But what we actually don't often think about is that people are not standardized. So there is always going to be some variation. So rather than rigidly sticking to a process, managing this variation requires defining an envelope of variability. So in my research, I see that design methods can help define what is your minimum lovable service, so where people will be happy with what kind of service you're providing them, and then identify where variation might need to be accommodated. It also helps to build redundancy into the system. For instance, this was a desktop walkthrough for people for developing patient-centric services for chronically ill people. And the team found that patients had to go through several steps simply to enter the care process. So they tried to reorganize touch points and determine which steps might be optional or even be removed altogether so as to lower the threshold or the pains of coming into the service. In another case with telecom service providers, a co-author of mine experimented with using mistakes and delays in the scenarios that they were undertaking during a service walkthrough. And they had also quite some good insights in terms of how could people improvise and how should they rethink building some of the redundancies into their service. So that was like a bit of a shift in how they were thinking of doing things. And when I say define an envelope of variability, I would compare this to kind of doing a warm-up before you exercise. So when you do a warm-up, you kind of, you want to minimize the risk of injury. So if you think of this as doing a warm-up, so when you explore variations in the design phase, you're also warming up for possible disruptions in the future. And that's not to say that you will be fully prepared for everything that comes, but it just tends to put you in a different state of mind where you're more open to also improvising. Destabilize routines and habits. So routines and habits are a mechanism by which people reproduce and conform to existing norms and institutions. So if we want to intentionally reshape our systems, then we need to destabilize habitual actions and routines. And I think service design has the potential to do this. So in this picture, we see participants using a double stethoscope. This was in Region Sörmland. And this was designed to disrupt how people think about a doctor and patient meeting. The point of creating this stethoscope was to provoke reflection on what it might be like if the patient could hear the heartbeat and the doctor explained to them what they were hearing. And it was interesting because I thought, oh, this is fantastic. Why hadn't anybody thought of this before? Because this was done by Felicia. And then I kind of Googled an image and I realized that they do actually use double stethoscopes for training purposes. So this is how you teach a future doctor in training. I don't know if this is true for Sweden, but I imagine it might be the same. And the fact that, okay, it was never considered that we could actually use this in a patient doctor situation. So just having someone else come in from the outside and being able to recreate that just to do things differently. So the kind of disruption sets people on a path to dare to think and do differently as well. And such disruptions then also have the power to change mental models. So mental models specifically involve actors' assumptions and beliefs about how something works and how to act based on that understanding. So for example, it could be a metaphor such as thinking about a project process as a roadmap. So there is also evidence in academia on how service design practices reshape mental models to enable innovation. In this particular workshop, we had participants who were asked to mold what their concept of person-centered care was as a way of externalizing their mental model. And you can see that there are many who have little figures. In some cases, it's two figures. So it's two people in the care meeting. Some people saw it as a group where people could interact with also other patients. And then at the top right, you also see something that looks like a prickly pear or fruit. I'm not entirely sure what this person was going for. But the fact is that these served as artifacts for sparking discussion and confronting assumptions within the group, because not everybody clearly saw it as two people or a group of people being in care. To shape roles. And this one actually also is quite inspired from my colleague Tim's work. And when we say shaping roles, it's here we see an actor map of people that were associated with the discharge process. And in this particular exercise, the team first mapped the current network of healthcare professionals that the patient interacts with, both in the hospital and then when they come to primary care after the discharge. And then they redid the map and included the role of the coordinator, which was what this project was about and how this coordinator would then work in this discharge process. So two things happened over here. Was that first they realized that it was an overall quite complex process and that different members of the team played a very small part in the entire process, because they thought they were doing a lot of work, but then they realized like, oh, actually it's only this little part that we stand for in all of this process. And then they also thought about that this must be super overwhelming for a patient to meet so many people and to keep track of so many things. So based on this insight, they kind of started to question the assumptions they are making when they were creating this role for the coordination nurse. So they're thinking, how could they make this role more flexible? What responsibilities should this person have so that it would be a smoother journey? And this was different because earlier they were just imagining that this coordination nurse would be like a regular nurse and would just do the paperwork when the discharge would happen from the hospital to the OPET ward. And as a result of this exercise, they kind of shifted how they might shape this role and what other responsibilities this nurse might take that is not tied to being a regular nurse, let's say. But by doing it this way, they minimize some of the problems that could have come up when they would have had they introduced this role in practice without really doing this kind of reflection as well. So resilience and systems literature also emphasizes the importance of relationships. So in the Trigo Effective Hemgång projects, it's the same discharge process. Most of the team members had never interacted with other roles. So if they are in the hospital, they're quite often very concerned with what they are doing there. If they are in the primary care, they're concerned with what they are doing there. And they never really had a chance to meet up with each other. So with this project, that kind of created an arena for these actors to network, meet, get to know each other's points of view. What does their daily work look like? What do they actually do? And kind of share their experiences. They also realized that, yeah, well, we can be creative. And then they benefited more from coordinating their efforts and actually pooling their resources. So that was quite, and a lot of them continued this because they realized that, okay, we actually need to talk to these other people because they can help us understand certain things better and what the patient needs. So service design can be used to create these kinds of arenas where you can enable relationships between the people who actually need to be talking to each other for providing better service to the end user or the patient or the client. Experimenting with alternatives. This is also a way to sort of increase adaptability and also try to introduce redundancies into the system. So here we have an example of a cooking class that was held for diabetics and where patients along with their relatives were invited to participate. Some of the other ideas the team had at this time were around having a patient council or like a peer group meeting, creating a meal plan, giving nutrition advice. But the group also realized that they could, of course, provide these meal plans and advice, but there's also the context of the patient, which probably has the most impact on their diet. So because quite often it's not maybe the patient who is cooking, maybe it's somebody else is cooking and they don't know what is good or what is healthy, or they don't keep track of the meal plans. So they started holding these cooking classes with recipes that were specially tailored to diabetics, and then having the relatives come and then actually prepare it together with the nurses. So involving the relatives was also a way of sort of inciting commitment from them to support the patient in their journey to sustaining good health as well. And this was one of the most well-received ideas that they had had. Another example also from the discharge process was a lot of people, they tried out different models. So one of the ideas was to have a meeting before the patient was discharged so that you could get an idea of what it is that the patient wanted, how does their home look like. Then they also had, based on interviews, they had an insight that a lot of people are overwhelmed by the number of people who come to their home when they're discharged, because it was like 6 or 7 people that show up, and this is kind of uncomfortable for people. And then they decided, well, yeah, okay, this is where maybe it should only be the coordination nurse and then one other person, depending on what kind of problem the patient is having. And then based on the needs, we include more people. Other ideas were like to have a transition team so that before a more permanent team was appointed, they could just have a temporary team that kind of facilitates the transition from hospital to home or hospital to the korttidsboende. So they tried out different variations also to test what works for certain patients, what doesn't work, and which, yeah. So they had sort of like a repertoire of prototypes, let's say. And I think this is a good way to also make sure that you're taking in, that you have also then backup plans in case something doesn't work out and you have this repertoire, then you can build and pick up on things from here. And then we have facilitating shift in logics. And this is at the absolute system level. Service design practices have also been identified as a transformative force for changing institutional arrangements in service ecosystems. The experiential, reflective, and participatory nature of service design practices sort of aid actors in creating the conditions for changes in systems. So during my time as a PhD researcher, along with several other colleagues, we also authored this book chapter where we explored shifting the logics in healthcare, because my research was in the healthcare sector. How can we help with this paradigm shift from biomedical to person-centered? And we identified that the context, role, processes, and outcomes is where service design can leverage its potential to sort of create that shift. And also all of the things that I mentioned before is what happens in smaller sort of cycles over time, and that's when shifts in logics happens. It's also like shifts in logics are not going to happen instantly. It's actually like a kind of slower process. But for that to happen, we need to do things at the micro and the meso levels so that we see those transitionings happening later. And then, of course, yeah, Eric asked me if I'm going to talk about the pandemic, and I said no, I was trying not to. But yeah, it would be incomplete without at least pointing to where we see ourselves right now in terms of the pandemic, which is putting pressure on healthcare and welfare systems. And what we've also seen is that there's been a lot of innovative responses. So I have here the Observatory of Public Sector Innovation response tracker. I took the screenshot yesterday, and they have like 452 entries from different countries about how they're innovating in terms of distributing welfare money and amongst other things. And then I would like to also put this to you is to think about resilience as the flip side of innovation. So the fact that we were faced with this crisis has kind of pressured us to come up with innovative responses. So we should think about innovation as an outcome of resilience. And part of building resilience in complex systems is strengthening cultures of innovation. So I see resilience and innovation actually going hand in hand. And that's why when we talk about service design as being an enabler of innovation, it is not much of a stretch to say that it could also enable resilience. Even the European Commission's call for improving resilience in health systems highlights the need to adapt effectively to changing environments and identify and apply innovative solutions. So I invite you to think not about innovation and resilience as two separate things, but as things that actually work together and that you can actively incorporate into your own organization. So what can you do? Rally your colleagues and teammates. Remember, this is not an individual effort. You're in it together. Understand what kind of change you are addressing. Is it adaptive? Is it transformative? Identify intervention points in your own challenge and situation. Start with small experiments, and remember, it's ongoing and this takes time. So that was all for me. Thank you.
Thank you so much, Vanessa, for a super interesting presentation. I think we're all a bit wiser after this. And we have a couple of questions that I'm going to address to you. And one is, you had this last slide, like how some tips basically, but as an organization, like how, if you want to become more resilient, like how do you get started more practically, or rally a small team and start with defined project? But can you give me an example what that could be?
Yes. And like I said, I don't see resilience as something that is a separate goal to work towards, because a lot of the things that we are doing, and this was also an eye-opener for me when I did my research, was that what resilience literature is talking about is very intertwined with what innovation literature is talking about. When we are using design to innovate, so when we talk about ad hoc innovation or improvisation, it is a resilient response in some way. And some of them are more adaptive. So when we are having some kind of disruption, then it's more of an adaptive response. And this is something that happens in interaction with the context that we are in. And then the other way to think about it is if we are looking at long-term transformation. And that's what I mean with the shift in logic. So if we are looking to move from traditional healthcare to more patient-centered care, then it's the same as if we were also working with design in terms of innovating. So it's not separate at all. So to start with would be that you assemble the team, and then you go through your service design process, talk to your users, see what they actually want from you. And I think for resilience, you also do a lot of scanning, because if I go by the example that I gave about the New York Times, for example, they saw that their numbers were dropping, they were losing revenue, and they were thinking, okay, what's happening? And then they realized, yeah, okay, let's go out. They see people are consuming news, but just not picking up a newspaper and reading it. So if you miss cues like that, then you're running a risk of not sort of getting on that train. So trend analysis, look at what's changing, coupled with insights from your users. And I think design is good for this. And then doing these small experiments. Okay, let's try they tried out podcasts, they tried out new mobile friendly design. So they made certain smaller changes that actually help them then sort of get to kind of sustain their business and stay there and also get more subscriptions in the end. So I think it's about starting having a team in place and then doing these small experiments, because I also don't think that a service is ever done or perfect, because there's always changes happening and we constantly need to adapt to those changes. So I don't think that a service is done when it's done. But that's my view on that.
Mauricio has a question here, maybe connected to this. But if you get started and you have a small team and you do these experiments, can you measure resilience in a service, or can you measure progress over time? And can you really see that we have acquired like a more resilient system or a more resilient organization or services?
That's a really good question. And I have to say, I have been struggling with the evaluation a lot, even in my current work, because I think the kind of metrics that we tend to use sometimes don't really say anything. I mean, they look very nice as a number, but they don't really say anything about what are the outcomes for the people that we're actually working for. And I work in public sector, it might be different in the private sector. So I'm also thinking about outcomes when I personally think it's better for us to look at outcomes for the users and outcomes also for the internal customers or our employees. If they are doing well, do they have the mandate to kind of improvise when needed? Because a lot of times people are not aware that it's okay for them to do something, and then they are afraid to reach out. So I think creating that kind of space for them to experiment and allowing them, so doing that kind of a temperature check is more important. But no, I have actually never come across any kind of evaluation. I'm not even sure that I want to advocate for evaluation of how resilient an organization is, because it's also something that's really hard to measure. And yeah, it's probably only good for organizations to say, oh, we are very resilient. But at the end of the day, I think if your customers are happy, or your users are happy, or your patients are happy, that's the biggest indicator that you're doing your job well.
And because it seems a lot like a mind shift and a culture change within the organization, but if you don't have a way of measuring success, or how do you sell it internally? Like what buttons to push to or what will you scare the organization with in order to get your ways?
Maybe make up a metric, I don't know. No, but no, on a more serious note, I think I would probably use other metrics to make the case for it, because if I want to be entirely honest, I don't think I can say, oh, now we are 100% resilient, or we are 40% resilient. That's very hard. It's not something that is quantifiable. So I would rather look at what are the measure a baseline before maybe we do the experiments, to kind of see, okay, what how many complaints are we getting, or what is the kinds of problems that people are facing, and then we do the experiment and see, is there a change in those other metrics. There's also some level of causality that you're assuming here then, but I guess that comes with the kind of quantitative measurements that we tend to do anyways.
Adam wonders, what is sexier to the organization? Is it resilience or innovation? Like, what is easier to sell, or what is more attractive?
I'm going for the double whammy, where I'm saying resilience and innovation goes hand in hand. So I'm giving you the best of both worlds.
Resilient innovation, that is.
Yeah.
And I have a question here. Let's see. How do you manage to have lasting impact on the bigger system, especially if healthcare is depending on a lot on which laws the government implements, like in Germany? So I guess there are so many factors, but like, can you design the whole ecosystem, or do you start with one component, and how does that react or affect the other components?
I think I can share from my current work, where I'm in a public organization that's working, it's like an unemployment agency. Yeah, so they coordinate efforts between like the Försäkringskassa, someone, oh my God, it's all the Swedish
welfare.
names. Yes, public welfare. But what we realized is that quite often every organization is sticking to what they are supposed to do, and they are doing it right. But the way that the laws are designed means that even though everybody is doing exactly what they're supposed to do, there's still people falling in between the cracks, because there's no one who is addressing those specific problems or has ownership of those problems that they are currently facing. So every organization that they go to says, well, we can only help you if it's XYZ. Go to the next organization, we can help you if it's ABC. But their problems are like M&O, which nobody has ownership over. So, and then that goes to actually then using, if we find this data, kind of using that to create awareness at the sort of policy making level that there is a problem. And I think that then becomes the role, is like kind of shining the light on the problems. Of course, it's hard for maybe a smaller group in the organization to make those changes at the policy level, but we can do smaller things to kind of alleviate what we can at that level. But then it's about collecting those examples. It's like, here's a group of people that's really having a problem that is not being addressed by policy. So bringing that to the attention, because quite often people who are sitting in different up there in policy, I have no idea how it works in Sweden, but maybe they are not aware of what are the actual problems that people are facing. So they think, yes, of course, we have a well-functioning welfare system, but that covers all, like anyone who doesn't have a job or something like that. But then there's some very specific things, like you have to wait 180 days before you get some money for your unemployment, and then you have to wait for that. But in the meanwhile, the person's life is still ongoing. They need to pay rent and things like that. So there is this feeling of insecurity because they don't know whether they will make their rent or not. But the problem is not that the individual caseworker doesn't want to help them. It's more that they can't because the law doesn't allow them to, or it's not their ownership. So I think, yeah, shining light on the problems then.
We only have a few more minutes. For you who still have questions, Vanessa is gonna stay on till 9 o'clock, but we're gonna round off the seminar now. And then whoever wants to stay for another 10 minutes, you're more than welcome, and we will continue to discuss some of the questions that came up in the Q&A. With some reclam, some advertisement. We have another webinar at the end of March with Socialstyrelsen, the public health agency, I think, in Sweden, and how they use service design to digitalize services, basically to help doctors to support their patients. You'll get more information about this after, when we send out the presentation from Vanessa. Also, this is in Swedish, we will give away bollplank, like a sounding boards. So if you're interested to discuss service design more, or you have a particular problem, please just contact us and we can book an hour and we talk, we think together, and maybe we'll get wiser together as well. So if you have any problems in your organization that you want to discuss, please just get in contact with us. Also, we're always looking for good talent. So if you're curious about working with service design and you're curious about Expedition Mondial, please send me a mail and let's have a coffee and talk. So thank you, everyone. And thank you, Vanessa, very much for your great presentation. You made us much wiser. And for anyone who wants to stay for another 10 minutes, we will continue the discussion and I will bring up some more of the questions. And for the rest of you who have other meetings or whatever, we wish you a good Thursday and hope to see you at our next webinar. So thank you very much.
Thanks, everyone.
All right. There we go. So Vanessa, you're back, and some people are logging out, but there were quite a lot of good questions. Thomas Holm wondered, are you familiar, oops, I lost the thread here. Are you familiar with the literature on transition design? If so, how does this relate to design as an enabler for resilience? Would be curious to hear how you think around this.
Yes, I am actually familiar with transition design, and I know that Terry and Cameron, who are at Carnegie Mellon, are the ones kind of leading that. And yeah, this is academia for you, but when we write research, we're supposed to stick to one stream of theory, and my research built on service design theory. And service management, systems thinking, and resilience literature. And when I came across transition design, it was too late for me to change what I had already built on, because their epistemic view is also more about decolonization and those kinds of aspects, which is not as much in the streams of literature that I use. And while I have read some of the work, I haven't done a deep dive in the same way that I have in the other streams. So actually, I was very, very I took on quite a shine to the idea that this transition design would have been great for me, because it's also talking about making those changes from current ways of thinking to new ways of thinking. But they go in with also this decolonial lens. So how do we decolonize design? So that's where I'm at with transition design.
Another nerdy question here from David. When you mentioned designing for capabilities, is there any connection to the capabilities approach within welfare economics brought up by Nussbaum and Sen?
No, when I'm thinking about capability, I'm actually thinking more along the lines of design capability, like in Lisa Malmberg's work. And then there's also Marcia Arico, who has also done work on design capabilities in organizations. So those are the kinds of literature that I'm drawing on when I talk about capability.
Do you have any reading recommendations about resilience in general, or designing for resilience? Except from your thesis, of course.
There's no real good handbook or anything out there, at least not in terms of, there is one book called Designing for Resilience, but it's not related to design as we think of as here. It's more a human factors kind of thing, but I'll look up the exact reference and then I'll put it in my slides so that people can get a hold of it.
And your gut feeling, do you feel that organizations are becoming more and more resilient, or is it going the other way around, that we're steering more and controlling more and leaving less to the system to adapt and deal?
Well, I guess saying all organizations would be a very blanket statement, but I think at least the pandemic has triggered this kind of need to or an awareness on like, oh, how should we be resilient? How do we deal with this? And I guess that's why there's a lot of interest in how might we be resilient. So I think depending on the domain, it depends on, are you geared towards planning and control, or are you geared towards adaptability? So I guess if you're in Volvo in the car factory, then you're more geared towards planning and control because you have a certain manufacturing process going, and you come with that sort of logic in your organization. But if you go to healthcare, then you're thinking more about adapting and transitioning because you're dealing with people. So I think a lot of the domains kind of limit your logics. And I think that was what was interesting about Tim's work, for instance, is because he came in with this service kind of perspective and had to make them think about a service and not just their software as a product. So, yeah.
And another question here from Mauricio. Can you clarify in your table what you meant by informed by hindsight, insight, and foresight?
Yes. So with foresight, it would be like foresight is coupled with strategic foresight and strategic innovation. So there they actually do like trend scanning, and then they have like these horizons. So there's a bunch of tools to do foresight planning. And I think those are what can be helpful in terms of if we want to proactively design for change. And that's why I said if you're looking for long-term transformative change. So now the hot topics, for example, would be AI, Internet of Things. Those are things that are on the horizon. And then kind of shaping, if you're already kind of using those tools to test, okay, how might this actually fit into any of our processes that we might be able to improve something or provide a service that's coupled with that, then you would be using foresight. If you're looking at insight, it's then the kind of work that you're doing the as is right now, what's happening. You go, you talk to people, and then you realize, oh, this is a problem. What can we do to resolve this? Then you've had an insight. So that's more interactive. It's not something that you're pre-planning. And then hindsight is when you analyze after things have already happened. So post hoc, and this is quite common in previous new service development literature, where service recovery procedures were analyzed after the fact. And that's why it's informed by hindsight. That's what I mean by it's informed by hindsight.
And is there there's a question here about how do you sell this resilience to private sector companies, for instance, a bank? Do you think there's a difference if you sell it or you're within a public or a private organization, and would you have different rhetorics or different arguments?
I think if I was selling it to private sector, I would always, I know this sounds really strange, but I guess they always want to know how it's going to impact their profits and their income, that kind of baseline. So I would also have economic sort of variables that are built into that. Okay, if we are quick to adapt, what does this mean? Does it mean that our employees are more productive because they have more freedom to adapt? So those kinds of, I would emphasize probably those kinds of things.
And on a, maybe it's a vague question, but from like a leadership perspective, I guess if you want to build a resilient organization, you need to let go somewhat of the control, if I understand you right. Like what would it mean as a leader? What can you think of or think about, or what can you facilitate in the organization in order for it to be more resilient or become?
And actually, leadership is also one of the most important things that came up in resilience literature, is that if you don't have good leadership, it's often that none of the measures will work, because people are always looking towards the leader, like the signals from their leader on how they should handle certain things, because then they understand, okay, we have permission to do this, or we don't have permission to do this. So I think it's like you said, that you need to be free, like you need to let go of control and then trust that people who are doing their job will do it well. And people also tend to get, and I've seen this in research, is that the more freedom people have, they're actually more likely to think more creatively and do a better job, and are more willing to improvise, or are better at improvising also, because they know that they have that kind of mandate from their leadership.
We're going to round off here. Thank you very much once again, Vanessa. There are a couple of more comments here. Could you write down the names of the design capability sources in your slides as well, please? We will make sure that those names are in the email or in your slides, Vanessa. And yes, Gunilla, you will have access to the slides. We will send them out after this webinar, either this afternoon or tomorrow morning. So, once again, thank you so much, Vanessa, and thank you so much, everyone, for listening. And stay tuned for more webinars. Okay, thank you.